Hello, everyone. Welcome to the Arthritis Society's special edition of Arthritis Talks, Arthritis Pain and Delayed Surgery. I'm Dr. Sean Bevan, Chief Science Officer at the Arthritis Society, and I'd like to welcome all of you joining us online and over the phone today. If you're on this webinar, I probably don't need to tell you that COVID-19 has caused thousands of arthritis surgeries to be canceled all across the country. Over the last months, the Arthritis Society has received countless questions about how long the delays will be. People are also looking to us in greater numbers for help in managing their arthritis and their pain, especially as some have less access to their healthcare teams right now. So that's why we're hosting this event. Our two experts today are on the front lines, helping people with arthritis manage through this difficult period. Before we get underway, just a few logistics. First, the webinar is best viewed on a laptop or desktop computer. If you have a question, use the Q&A button at the bottom of your screens, or you can email it to arthritistalks@arthritis.ca. We will try to get to as many questions as possible during the hour, and thanks to those of you who have sent questions in advance, and that has really helped us to prepare much of the presentation today. You can click on the chat button to connect with other participants and the Arthritis Society's chat moderator. You can also close the chat window on the screen if you'd like to. Just click the downward arrow on the top left of the chat window and click close. So with that, let's get started. So We the Arthritis Society is Canada's national charity, dedicated to creating a world where people are free from the devastating effects arthritis has on lives. And we do this by funding research, by advocating to governments on your behalf, and providing timely, evidence-based information and support to help you live a good life. This Arthritis Talks webinar is just one of those forms of support we provide. I'm pleased to welcome Dr. Raj Rampersad, orthopedic surgeon at Toronto Western Hospital, and Marcia Corielli, a physiotherapist at Toronto Western Hospital, who will be speaking with us today. Many of the questions we received in advance did follow similar themes, so they're going to address them first, and then we will have time for some additional questions at the end of the presentation. So today we will be covering surgical wait times in Canada and the impact that COVID-19 has had, what to expect as we start to see economies and hospitals open up and restart elective surgeries, and then how to manage your arthritis and arthritis pain at home. So let's get started with the first group of questions. Raj, we know that COVID-19 has changed so much for so many people. Can you give us a sense of how COVID-19 has really changed the landscape for scheduled surgeries in the country?
That's a great question. Thank you for that. So if we go to the next slide, I mean, it's one of these things that it's made an already challenging landscape that much more difficult. And I'll explain a little bit about what I mean about that. So arthritis is quite common, in particular osteoarthritis, which is more of the wear and tear of joints, is one of the most common things that affects Canadians and people around the world, about 1 in 6. And in fact, probably currently the number is actually up to 1 in 5 and predicted to even be 1 in 4 as the population ages. And many folks on this call, I'm sure, are suffering from arthritis. And osteoarthritis in particular is one of the commonest causes for joint replacement surgery, particularly of the hip and knee, but it also affects the shoulder, the spine, and the foot and ankle. And so about, 15, anywhere from 10 to 20%, depending on the scenario, of folks require surgery or end up having surgery because their osteoarthritis has gotten to that point where they can't manage it anymore and then further go on to surgery. One of the issues with that is, although we've made some progress, and if we go to the next slide, the wait times issues that we have made progress, particularly for hip and knee replacements, even with the progress that's been made, about a third of individuals don't meet the benchmarks of having a joint replacement if they need it, or have elected to proceed with it and have their scheduled surgery, don't get it within that benchmark. Obviously, with the current situation, that's completely changed. And for other joints, so if it's your ankle, your spine, the wait time for those surgeries often even more frequently well above that 6-month mark. So if we go to the next slide, we'll show you even for hip and knee, the variability from one joint to another is significant, but even for joint replacements, which are the most common for hip and knee, you can see across the country, there are very different variations in the number of people who meet that benchmark that was set some years ago of it's to have a joint replacement once as you choose to proceed with one within 6 months. And in the East Coast, it's at 50%, and you can see it varies quite a bit across the country. So certainly wait times have been a problem and now are going to be a more significant problem. And the impact of waiting on surgery becomes an issue. So if we go to the next slide, so from a surgical perspective, as most of you know, all scheduled surgeries, so things that are not life-threatening, things that are not urgent, where harm would come to you if you didn't have an operation quickly, has stopped since essentially mid-March, pretty much across the country, and varying time frames for different parts of the world. But for Canada, the last 2 months, elective surgeries scheduled surgeries have stopped. And in Ontario, where we are, there's about 12,500 surgeries a week that are being canceled. So across the country right now, the number is well over 100,000 and continues to increase. And having a delay in surgery, which many have already been waiting for 6 months or potentially more, is now been impacted, obviously, that much further. And that wait and being waiting in pain, obviously, while you're choosing to have surgery to begin with, does have significant health and social implications. So if we go to the next slide, we can, right now we're trying to address that wait, and most provinces are slowly starting to look at how do we start to do our scheduled surgeries. And I, in fact, have my first quote unquote, scheduled surgery for more urgent cases. So not even doing the true scheduled surgeries yet, but even urgent surgeries that should have been done had to be delayed. So we're trying to get through that process first, and that's just happening, next week and this week at my institution. And the issue is this is not a one-to-one thing. So 2 months of stopping surgery doesn't equate to, okay, well, in 2 months, we're going to be back up and things are good. So it's a phased process. So we go to 25% of what we normally do, maybe up to 50% over a series of time. And it's dependent on a whole bunch of factors. And the problem is, unless we go over our normal capacity, which is already strained, we may never catch up in the sense of the true word of catching up and being where we need to be. So there's no greater time now for advocacy and investment in arthritis care, because arthritis surgery happens to be one of the most common surgeries across the country. And in fact, in most places, it represents anywhere from 20 to 30% of the operations done in most major hospitals are in fact orthopedic related and directly related to arthritis. The next slide. So why is this important, and why is waiting even longer a problem? Arthritis does more than hurt. And so the issues that happen with pain causes limited activity, causes you to not do the things you normally do. So productivity, either working if you're working, or if you're not working, caregiving, things you do around the home, those things are lost. And the more limited you are, you lose independence in your ability to function. And that can lead to social isolation for some who don't have a supporting system around them. And ultimately, lack of mobility has been shown to increase your risk of poor health. And in fact, if you have arthritis compared to a peer who doesn't but has the same health problems, your likelihood of actually ending up in a dependent living situation and even dying sooner are both increased if you have arthritis. So it does much more than hurt, and that's not something that I think the general population is really aware of. Sometimes it's, well, it's old age and it's wear and tear, deal with it, but it can be very catastrophic to somebody's quality of life and literally their life in certain circumstances. The next slide. So in the sense of, how we're going through this, with regards to this question. Sorry, I just have something blocking my my screen here so that I can't see the question. Just give me 1 second. There we go. So prioritization will depend on a variety of factors, as I said, and it's very dependent on the regional situation. So everywhere is a bit different. The number of stable COVID-19 cases that are occurring in that region. Does your hospital have a recent breakout? Do they not have a recent breakout? Is there a stable, at least 30-day plus supply of personal protective equipment? Medications, and interestingly, at one point when there was during the sort of ascension of number of cases and more people in intensive care units around the world, the medications used for general anesthetics, etc., normally are used just for short periods of time during surgery. Because they were being used 24 hours a day to keep people in quote unquote a medically induced coma, that consumption of that medication went way up, and there was some shortages on that. Fortunately, that is significantly improved. Other things are the impact of inpatient beds, and if you need a more complicated surgery or you have significant health issues, are there enough ICU beds to ensure that patients are treated safely? The number of nurses, everything has changed in how we are able to deliver care, and it's not currently, even if we started back tomorrow, say normally we would do 4 joint replacements in a day, you're now doing 3 because there have been additional steps to ensure safety of not only the patient and the person having the surgery, but all the staff around them. So there's certainly multiple steps. Then we get into, well, what is urgent? What has been, cancers have been delayed, cardiac surgeries have been delayed, things that are potentially more life-threatening, and those things are being prioritized. However, there is certainly push because of the pure volume to ensure that things like scheduled surgery such as hip and knee replacement, and folks who are suffering from increased pain because they're not as mobile. So that's a secondary effect of the pandemic, is by not being active, by not being able to access your regular exercise program, whether it's in a pool, other social activities, in fact, that can make your arthritis pain, in fact, worse. So we know our folks, unfortunately, who are waiting for these surgeries are also potentially suffering more, and we're trying to ensure that they are not put in the back burner compared to other areas. The next slide. So how do we clear the backlog? We certainly need to boost operating capacity. As I said, if we don't go above where we were, we can't catch up. So we need to be able to slowly and safely phase back the capacity, but also ultimately increase it. And that requires other resources. So more nursing care, more pre and post-operative care to ensure individuals are appropriately educated. How do you get ready for surgery and post-surgery? And this is regardless of the COVID situation. These are important things that are often gaps in care that need to be boosted, and even more so in this current environment. And all this needs funding. There's no question. And on top of that, the number of individuals who are waiting to see surgeons in their clinics have also been canceled for those appointments, often that they've been waiting for many months and sometimes a year or more, are also now having to wait even further. So this whole process is really going to have a significant impact over the next 2 years for these types of situations. The next slide.
Great. So thanks so much for all that information, Raj. As governments combat the coronavirus, the Arthritis Society is working really hard to ensure that the needs of people with arthritis are certainly taken into consideration. And I've already seen some questions actually come up in the Q&A about this. And so we are really focused on making sure that people have access to the medications that they need. We need to be, to the point that we were just talking about, we really need a coordinated plan for reducing those wait times for joint replacement surgery when these scheduled surgeries resume. And we also are really focused on investments in arthritis research, which is fundamental to a lot of this. So I'm really just excited to take the opportunity to share with all our viewers right now that just today we have launched a new Take Action campaign. We encourage all of you after this webinar to visit arthritis.ca/takeaction to find out more about this really important effort and to add your voice by emailing your elected representatives about these important issues. Because surgical wait times for people with arthritis is one of the Arthritis Society's main priorities, we'd love to get some feedback from you right now on the following questions if we could. So the first question is, has your surgery been delayed because of COVID-19? And you should see it pop up on the screen. If not, you'll also get it after the webinar. And the second, how concerned are you about wait times for arthritis surgery in Canada? So thank you for all that feedback. I think we'll go to the next question if we could. Next slide. So Raj, as we look to the next phase, as these schedules start to resume, what can people expect, and is it safe to go into hospitals in the current climate?
Even better question, and an anxiety-provoking one at that for many. So as I said, things are definitely different. They're different for me, and they're going to also be different for you and all the supporting staff that work in the hospital. So the next slide. So COVID is unfortunately here to stay, and like many viruses may circulate back in different seasons, and we have to be obviously prepared for that. But this one has obviously a much higher degree of concerns and possible significant health risk. So first things that we're doing are to screen individuals and for COVID symptoms, and also anybody having surgery, they have to get a COVID swab done prior to surgery in an appropriate time frame. Obviously about symptoms, we know that there are individuals who can be completely asymptomatic and be carriers, so we have to be able to screen them. And we also know that the tests, unfortunately, are not 100% perfect, so there is a possibility of somebody having the virus and having a negative test. So those are concerns with any test. There's never potentially 100% rate. Obviously, the staff have to be protected. And things are changing in that we are trying to do much more virtual care, reduce the number of people who are in the hospital at a given time or in a specific area, spreading out waiting rooms, all the things that have to be done. Some clinics are saying, you know, we'll text you in your car, only come in when we're ready to see you, and making sure that appointments are scheduled in a way that individuals can minimize and maintain social distancing within a healthcare environment, which obviously is not the norm. So all of these things are doing in between surgeries. As I said, the number of surgeries we're going to be able to do in a day are actually going to reduce because we have to do what we call a terminal cleaning, which is essentially deep cleaning everything in the OR between individuals. And normally they're clean, and they're cleaned very well, but this is, you know, using virus wipes, things like that, to completely and as best as humanly possible disinfect. So when you come to a hospital, there are always risks. So normally pre-COVID, the big worry would be superbugs, so getting something like an infection in your joint. So those are precautions that were taken. Now the level of precautions with something like COVID just has gone up significantly. So you know, ultimately speaking, for scenarios like this, where you're not having symptoms, etc., and you want to absolutely report your symptoms, do not underreport under any circumstance, because you are putting yourself at risk and others. Next slide. I think there was another related question. Yep. So, so what extra precautions can you take? As I said, reporting your symptoms is very important part of that, and not withholding it, especially if you do have an impending procedure and you've been waiting for so long. There might be some anxiety around, well, I don't want to lose that opportunity, but in those situations, we obviously take that into account, and we would not put somebody we shouldn't put somebody back at the end of a queue if a medical issue comes back. At least I'm not aware of anybody that does that, and if they do, then they need to come and talk to me, because that would not be very, very well received method of treating any individual. So obviously, main symptoms, again, I'm sure you've heard it a million times, but you're going to hear it a million and one more times: fever, cough, shortness of breath, sore throat, runny nose. Those need to be reported and in isolation. They don't all have to be there together. And as I said, don't withhold. And if through multiple screenings there's any concern that you have these concerns, then your surgery will be rescheduled. You'll be retested. So we try to test folks as close to the surgery as possible, ideally within 48 hours. And obviously, regardless, prior to, in the hospital, out of the hospital, is continue to follow the public health recommendations, which I think we're all quite familiar with. And in our institution, everybody's wearing a mask, so that's going to be the new norm. Is there another question? So right now, majority of hospitals, to enable reduced number of individuals and enable social distancing policies, we are no visitor perspective, which obviously is very challenging and anxiety provoking. Lots of our patients are FaceTiming with their family as much as possible, or using video chat the best as possible to enable that. Improve communications from the medical team needs to be there to ensure that that communication is open to folks that you allow us to communicate with on your behalf. So the visitors will also, when that is allowed, and there's no timeline for that yet, we'll also have to follow public health recommendations around wearing masks, social distancing, etc. So, okay, another one after that.
Yeah. So I think it's Raj, it's been an interesting time for a lot of patients as people have had different access to their healthcare team. So what would you recommend for people who are actually experiencing worsening symptoms right now?
So I think that's a very important point and question, in that, as I said, there's concerns. Some folks we know are not presenting themselves to institutions because of a concern, to an emergency department or a walk-in clinic, or even to their own family doctors, because either the doctor's office is closed or not able to see as many individuals, or not going to emergency department because of concern of acquiring, getting COVID. Obviously is understandably concerning for many people. So we do know that some folks are, for lack of a better phrase, suffering silently when it comes to if they're having arthritis pain. So if it is worsening, and certainly if you have other medical issues, then definitely you should be going to the emergency department, calling 911, our paramedics, our frontline, the whole team, everybody is dealing with this in an appropriate manner, and certainly are equipped to keep you safe when you come to the hospital, as well as themselves. So you should not withhold seeking medical information for something like your scheduled surgery has been canceled, you're waiting, and you're actually deteriorating. unless I'm calling all my patients regularly, and we're trying to do that, many of us are ensuring that we're contacting patients who've been canceled or who have been waiting and are coming up but were canceled. Are you getting worse? But certainly you're your best advocate. So reach out to the doctor's office and let them know that your symptoms are deteriorating. And as I said, because you are not as mobile and don't have access to some of the things that probably gave you relief, such as an Aquafit or an exercise program, then let your surgeon, let your physician know. Many of us almost immediately turned over to doing virtual visits, telephone visits, so either with or without video, and these have been working very effectively. There's quite a bit we can do with telemedicine. So there's lots of options, and there's places doing telephysio care and rehab in the home. So there's a variety of options out there that obviously, but if you don't reach out or don't have, you know, the ability to call them, it's unlikely you're going to get a call. So ultimately, you have to advocate for yourself, and folks are delivering medications, etc. So there is quite a bit that has happened, and it's just ramping up. And the good news in a lot of this, if I can be somewhat optimistic, is how we deliver care going forward, post-COVID or with COVID, is definitely going to change, and more of these options that allow you to get help without having to come all the way to the hospital, pay for parking, all the things that happen when you don't need necessarily an emergent piece of medical help are hopefully going to change. So I think there's some positive things that will come out of this, and we just keep doing our best.
Right. So we also know that there's been a lot of information or a lot of questions about arthritis medications and such. And we've actually just given the nature of the coronavirus and COVID-19, people asking questions about whether they are immunocompromised. So could you just speak a little bit to that, please?
Oh, that's a great question. So arthritis itself is a broad word. It can mean a whole bunch of things. And there's other phrases, rheumatism, you name it. There's a whole bunch of names that don't necessarily specify what arthritis is. And in fact, there are a whole bunch of different arthritic conditions, as you see on the slide, and over 100 different inflammatory diseases. By far the most common is osteoarthritis, which is at the bottom of the slide here, where it's mostly wear and tear. And there are different types of osteoarthritis, but the basic principle is this is something that is more, can happen in young individuals, but does tend to happen as you age. And it's wear and tear, and the most common form of arthritis, whereas something like rheumatoid arthritis is very different in that it's an autoimmune disease where your own immune system is attacking the tissue around the joint, destroys the joint, and causes significant inflammation, and is usually a more aggressive or rapid type of arthritis. So the two are very different in how they occur. However, neither one is isolated necessarily from the other. So you can have osteoarthritis because it's so common, even if you have rheumatoid arthritis, and vice versa. But osteoarthritis is not something that specifically is associated with being immune compromised. So you're not at increased risk if you have only osteoarthritis. Okay. Is there another question related to this? Yes. So the medications essentially that are used for osteoarthritis typically are essentially anti-inflammatories. So things like naproxen or other anti-inflammatories that are out there, whether they're over the counter or prescribed, and essentially also Tylenol, so acetaminophen. And but there's no other real medication treatments for osteoarthritis specifically. So those medications don't increase your don't immune compromise you, and certainly you should continue to keep taking osteoarthritis medication. The medications for rheumatoid arthritis, which you need to be clear which one you have, are a different breed of medicine, and those are what we call biologic medications that can affect your immune system. So you need to be clear. And general principle is don't change your medication until you speak to your healthcare provider. Okay, so medical cannabis, there's no known effect with regards to increasing any issues with COVID, and there's no benefit, therapeutic issues around this, but in the sense of its ability to help manage arthritis or osteoarthritis or pain in general, certainly we have many of our patients who have included this as part of their pain regime, and some swear by it and are able to get off of opioids or other medication, and others, they try it and it doesn't help them. So it is a mixed response to it, but certainly it's something for you to continue taking, but obviously inhaled, so smoking cannabis is a whole different issue with regards to potential respiratory effect, and definitely if you have a respiratory illness, is the last thing you want to be doing. Right, so taking dietary supplements, it really depends on where you are in the disease state. So some of these things have been shown to help, but they tend to help in the early stages. So mild arthritis, not much evidence that when you're pre-joint replacement that they're going to do too much, but it's one of these things that in appropriate amounts, they are relatively safe, but if overdosing anything, even if it's natural, doesn't mean it's necessarily safe. So certainly we, in the sense of its relation to COVID, there's no known issues around that.
Great, Raj. So that was a lot of information. I'm going to switch gears a little bit with Marcia. So from a physiotherapist perspective, what can people do to help manage their arthritis pain right now at home?
Well, so the one thing is pre-COVID-19, exercise was the best way to manage your arthritic pain. And the one thing that COVID-19 has not changed is it has not changed what the best management for arthritis is. It continues to be exercise. And really, it's any type of exercise. You can do stretching to make your muscles more flexible. You can do strengthening to make your muscles stronger. You can do balance exercises to help with your walking. You can do cardiovascular exercises to get your heart pumping and the blood flowing, things like walking outside or biking. Or you can just do sort of movement through your joints to get things moving. So during COVID-19, I know most of our schedules have been disrupted, and some people may have found more time to devote to exercise, and some people may have found the opposite, that they're sitting around more, that they're not doing too much. And so by not doing anything, you're actually making your arthritis worse, because rest actually makes you more stiff. And not moving actually makes your muscles more weak. So finding a moderate activity is really the best thing for you. And people ask, what should I do? And so you don't want to do nothing where you're going to get stiff and weak. And you don't want to do too much that your body's going to pay for it the next day. So you do want to find an activity that you enjoy doing, that you're going to do regularly, and you may want to do it in small increments. So you pace yourself, so you're not doing too much too soon. You may start off with, having a goal, like you want to walk for 30 minutes, but you may need to break that up into 10-minute chunks, where one day you walk 10 minutes, the next day maybe 11 minutes, or you may walk 10 minutes for a couple of weeks before you can bring that up to 15 minutes. And then the other thing too is you may come up with a schedule where maybe you're going to walk twice a week, and then stretch twice a week, and then strengthen once a week. So you can come up with different things to do every day. Next slide. So people always sort of say, like, well, what should I do? What should I do? And we sort of give the advice that motion is lotion. So anything that moves your joints around in a gentle manner that your body can tolerate is going to be beneficial. Especially now, a lot of us are probably doing everything virtually. So we're working virtually, we're socializing virtually, we're watching more television. So everything is sort of probably in a seated position. So by just moving all your joints around from head to toe, you're going to really help with stiffness. You're also going to help improve your posture, because sitting for a long time also sort of, puts your muscles in different positions that make them tight. And also just moving will help to decrease some of the pain that you're feeling. Next slide. So back pain really is the #1 cause of disability worldwide. And both Dr. Ramprasad and myself, we're both clinical leads for a low back pain program in Ontario. And that's because, back pain is so prevalent, and we see a lot of patients with back pain because of arthritis. And back pain because of arthritis is really best managed through exercise as well as self-management. Next slide. So during COVID-19, I know I've been spending more time in the kitchen experimenting with different recipes. And so I'm standing for long periods of time. So if you're cooking, or if you've found a hobby that you now finally have time to do, and you find that you're standing for long periods of time, arthritis in the back sometimes is affected by prolonged standing. But there are things that you can actually do to help alleviate the pain. So one thing is you can break up the activity, so you can alternate between standing and sitting. But another thing you can do is you can elevate one leg on a stool. So sometimes I just open my kitchen cupboard and I just put one leg up while I'm cooking and preparing meals, and then I alternate between one leg or the other leg. Another thing you can do is you can take a bit of a stretch break, so do a little bit of cooking or work on your project, and then lie down on your couch and bring one knee into your chest, and that just stretches out your low back. It takes some of the pressure off of your spine. Next slide. So again, some of us may be spending more time doing things that we didn't have time to do. We may be in the kitchen more, we may be gardening more, we may be decluttering our house or doing home renovations, we may be on the computer, like I said before. So you really want to try to pace yourself. You want to break up that activity into smaller chunks. You want to take frequent breaks and alternate your posture. The other thing too that I tell patients is, just because you're working from home in your pajamas doesn't mean you need to lie on the couch or lie on your bed, because those positions for a prolonged period of times are actually not good for your joints. So set up a proper workstation at home. Use a supportive chair with a roll underneath your back. Get a box and put it on the table and kind of make a sit to stand workstation, so you can alternate between sitting and standing. You can also use different devices or gadgets. So if you are having knee pain or hip pain with walking, you can use something like Nordic poles to help you through that. If you're spending more time in the kitchen and you're doing a lot of chopping with your hands, you can use like the food processor. You can use some of the wide grip handles that are available. If you're doing more gardening, some of these ergonomically designed tools will also assist you. Next slide. So where can you find trusted resources for self-management? So the Arthritis Society does have lots of resources that you can access. But the other thing too is, if you were part of an exercise group before COVID-19, whether you were part of a gym whether you're part of a Pilates or a yoga group, even line dancing groups. There are lots of organizations that have now found virtual ways to connect with their group, and they're offering online exercise classes, online line dancing classes, online stretch classes, meditation, yoga. So these are things that you can access virtually.
That's great, Marcia. So many people are having a hard time being at home right now. So how can people make the most of this really difficult time?
Perfect. So really, in terms of the exercise component, you know, we've kind of gone through that you really want to try to find time for exercise. And if exercise does cause pain, you can modify that exercise in some way, whether that be through, you know, using a knee brace, using a hand brace, using assistive devices, or pacing yourself during that activity, or taking breaks. The other thing too is, I know everyone has heard of COVID-19, but I'm not sure if everyone is aware of COVID-15, which is the 15 pounds that a lot of us may put on as a result of this social isolation that we're all going through. So we're all eating more, and we may be eating more because of boredom, because of stress, or just because we're cooking so many great meals. And so we do want to be mindful of what we're putting in our mouth. We want to choose more healthy alternatives. We want to use more fruits and vegetables that are throughout the whole kind of rainbow of colors. And also, if we're eating and we're bored, we want to maybe substitute that with something like flavored water or herbal teas, just so that we minimize the effects of COVID-15, as well as obviously social distancing for COVID-19. And then the last thing is to touch a little bit about virtual care options. So virtual care is something that, you know, it wasn't sort of very prominent or prevalent before COVID-19, but as a result of social isolation, many of us have had to adopt it as a forms of delivering care to patients. So I know our program has been delivering virtual care to patients, you know, for the past month. And patients have really benefited from this form of treatment. As a clinician, the patient interview is really the same, whether it's done virtually or whether it's done on site. I'm still asking the same questions, and I can gather a lot of information from the patient exam. So I'm able to see them walk. I'm able to ask them to do different movements, like how can they rise from a chair, like going from sit to stand. I can see how they move different joints, whether it be a hip, a knee, an ankle. I can prescribe exercises to a patient. I can watch how they do the exercises and make suggestions and modifications as needed. I can progress the exercise program. And again, you can hear the concerns that a patient has, and you can offer suggestions on how they can self-manage their condition. Perfect, next slide. So we focused a lot about how exercise and exercising the body is very beneficial. But really, we also need to exercise our mind and our soul during COVID-19. So you need to take care of yourself physically, but you also need to take care of yourself mentally, especially during this time of social isolation, and also this sort of just fear of unknown. So you really do need to take care of yourself. So that can include things like deep breathing and meditation. Or that it can include things like, you know, maybe disconnecting from your from social media, or maybe not watching the news for prolonged periods of time, making more social connections with your friends and family, or any other sort of like self-care tips, whether it be journaling, whether it be just celebrating small accomplishments of what you've been able to achieve. But really, you want to continue to try to do more of what makes you feel happy. And I know we've talked about how exercise is a great medicine, but laughter has always been shown to be the best medicine. So, you know, during this time, you know, find creative and fun ways to exercise, as well as to connect with others. And also to focus on yourself and your well-being. And so here are a list of reputable resources where you can learn more about both COVID-19 and arthritis management.
That's great, Marcia. So we've received lots of questions already through the chat, so we're going to get through as many as we can. So maybe I'll get started with a question for you, actually. And the question is, what kinds of exercises would you recommend for more athletic patients who would really like to maintain their strength right now?
So, I mean, there's lots of things that you can do. So, there's, weighted exercises. There's the use of like resistance bands and resistance tubing. There are more like high intensity training exercises like HIIT workouts. There's Tabata workouts. You can do like hill climbing. You can do biking. You can do more long distance walking. So there's a variety of exercises that you can do for a more athletic population.
That's great. And maybe just to follow up on that idea about what kinds of exercises, what about following surgery? How do you keep moving after surgery?
So similar concept. So usually after surgery, there's a protocol that they would give you where you start off with just gentle contraction of the muscles initially, then followed by some range of motion exercises, and then you do some graduated strengthening exercises. So first, maybe you would start in a non-weight bearing position, so something like you'd be doing exercises more in a lying or sitting position, and then as you got stronger, you'd be doing them in a standing position, and then potentially you'd add more resistance with weight, or you would do something like climbing a step or descending a step. So there's a progression of exercises that you can follow easily in a home environment post-surgery as well.
That's great. So Raj, we have received a number of different questions, all really relating to the prioritization of these scheduled surgeries once things start to open up again. Some people asking about if they've been impacted by COVID-19 themselves and now they've recovered, if they're a frontline worker, if the time that they've been waiting so far will have an influence. So do you have any sense for people about, how will different surgeries be prioritized when it comes to that?
That's a great question, but a difficult one to answer in that there are, as we stated earlier, so many factors that unfortunately will go into that decision. Certainly someone who has surgery has been canceled. So first priority is going to be obviously urgent, emergent things, cancer, cardiac surgeries where somebody could die or have a significant deterioration in their health or survivability. And then things like joint replacements, other types of surgeries that are scheduled that have been canceled, those will be prioritized. And most institutions are trying to distribute this. So it's not, I think it would be unfair to just say, okay, we're only going to do heart surgery for the next and cancer surgery for the next coming weeks, and then everybody else has to wait. So they are trying to distribute things as evenly and as reasonable as possible. It'll depend on the capacity of the hospital. So things will progress, but your health status, and it may be that they're going to do surgeries that require less resources. So some of the smaller surgeries. So if you're waiting for arthroscopy or you're waiting for a surgery that is very predictable, you're going home the next day or you're going home the same day, or even now hip and knee replacements, folks are going home in a day or two. So those surgeries are ones that we can better predict the resources required and how you're going to recover and predictably go home, versus more somebody who has a lot of medical issues, would potentially need to be in an intensive care unit or has a higher risk surgery. I suspect for joint replacements, those will be a little later on. So the more complicated the surgery is in scenarios where it's a scheduled situation, then those will potentially be a little later on once as the capacity continues to increase to deal with sicker patients, and things that are more predictable will start to happen. How quickly they ramp up and get those cases going is very different from each hospital, literally from hospital to hospital within the same city, from province to province. So it's impossible to give you a specific answer across the board.
And so would you expect that patients will be sent home earlier now compared to last year, given what we're dealing with COVID-19?
I would, part of it would be also the patient's desire potentially to certainly be in and out of the hospital as quick as possible. I think that's a rational and reasonable approach to this situation. And we always tell folks the longer in the hospital, the more likely you are to get sick. And COVID has certainly brought that to a new level of heightened awareness on both sides. So, but I don't think, you know, if it's indicated that you need to be in the hospital for X, Y, and Z reasons, that you should feel that COVID is going to make people push you out of the hospital inappropriately. Well before any of this happened, you know, hip replacements, even 10 years ago, people were staying in the hospital for a week. Now, literally, you're going home in a day or two. So a lot of those processes to mobilize and get folks moving, movement even right after major surgery is incredibly key to recovery. And so that's an important piece. And I know, if I may, I'm seeing a lot of the questions, and some of them are related to, well, everything hurts. I can't move. I can't exercise. You guys are talking about all these great things, but I can't move. Movement of the part that hurts is one thing, but doing anything anywhere else to get your heart rate up, to get those good humors going in your body, are helpful and can help the other joints. And small incremental movements, as little, even if you feel, well, I can only do something for a minute multiple times a day adds up and helps individuals. And the challenge when you're in that situation is the impact of pain and arthritis on your mental health and your mood. And there's no question with social distancing, etc., that's just made that scenario worse. And I think that's another important part to acknowledge that and reach out to your healthcare providers to help, because pain, as we said earlier, does much more than hurt. It definitely will make your mood worse, and then you're less motivated to do something. So it's this vicious cycle again.
Okay. So Marcia, we've had a number of questions about various supports people can be using. And so one in particular, will wearing athletic knee supports for walking make my knee joints worse in the way of mobility?
Yeah, so I look at a knee joint, a knee brace, and I look at it like an assistive device. So if you want to go for a half an hour walk every day, you know, for your mental well-being, for all the vitamin D that you're going to absorb from the sun, as well as for the cardiovascular benefits and the strength it's going to provide to your lower extremity, then that knee brace is enabling you to perform that activity. So is it going to do more harm to you? The answer is no. In that scenario, it's actually helping and it's of more benefit to you. But I wouldn't recommend wearing the knee brace all day for all activities, because if you're wearing it all the time, then you're not actually strengthening the muscles of your knee. So I would do a combination of two things. I would actually do strength training exercises for my knee, and then I would also wear the knee brace for activities that are bothersome.
Okay. And we've also had a few questions about biking, both stationary and road bikes. So can I do damage by bicycling for people with osteoarthritis in their knees, hips, and feet?
So we've actually found the opposite. Non-weight-bearing exercise through the joints is probably the best thing that you can do. And biking is such a safe activity during times of social distancing. The bike itself, you're away from others, and you're able to lubricate the hip joint, the knee joint, the foot and ankle, and you're also able to strengthen all those muscles in between.
Okay, and another one for you, Marcia. How can I get my heart rate up when pain limits the intensity I can achieve when walking or exercising?
Yeah, so there are ways to get your heart rate up through activities that are done lying down. So there are a lot of, say, core exercises that are done in a lying down position, or leg strengthening exercises or arm strengthening exercises that are done in a lying down position. That can get your heart rate up. Or things like a stationary bike may be able to get your heart rate up without putting the same amount of pressure through the joints.
Okay. So Raj, questions about cortisone shots or other things that people might have had right now. Two things related. One, is it still safe to be going into my doctor's office to receive them? And second, have they been delayed themselves in the context of COVID-19?
So to the first question, it is safe, again, using the appropriate precautions and personal protective equipment for yourself and the individual doing it. Obviously, exposing yourself to close social contact or medical contact for things that you don't feel are necessary at the moment would be the first rule. And then if your symptoms are worsening, then by all means do so. And the access is the same. It really depends on whether the folks who do that, do the injections, are still running them. So I think, initially there was definitely no unnecessary medical procedures, and that would have fallen in where individuals are not coming into offices unless it was absolutely necessary. So I think now those types of procedures are also going to start being done again, but really that'll be very practitioner and office specific as to their setup for allowing injections to recur.
Okay. So obviously there are many different factors that come into whether somebody would be considered for surgery. And one question in particular that's come in is, how is age factored into whether someone should have joint replacement surgery or not?
Right. So age is always a relative thing, as many of you know. So age, generally speaking, isn't factored in. In fact, it's the opposite. If you're really, really young and you can avoid joint replacement, then that's better, because the joint replacements, 15, 20 years, they can last. So obviously that means they have to be redone. So we still try to optimize management and do them later if possible. However, if you're 80, you can be healthier than somebody who's 50, depending on their medical issue. So it really comes down to the medical status of that individual. And obviously, the older you are, then yes, there's more likely other things. But if you have stable medical conditions, then having a replacement, in particular, age tends to not be a big factor unless you have those issues. And it's really a quality of life decision. And then obviously the safety needs to be assessed for each individual regardless of their age. Great.
I think we probably just have time for one last question from Marcia. What evidence is there that TENS machines are helpful?
Not too much is the answer. So, TENS is really just another stimulus hitting your joint. So really you could use a hot pack or an ice pack. And that's really the premise behind TENS. If you were going to spend half an hour doing something, you could use heat or ice for that, or you could move the joint around, or you could exercise. There are some patients who do find some temporary kind of benefit using it, but that's really what it is, just a very short-term temporary benefit, but it doesn't necessarily work for most patients.
Okay. So thank you so much, Raj and Marcia, for providing all of this really important information to help Canadians with arthritis manage through these challenging times of COVID-19. If you didn't hear your question asked, please do visit the Arthritis Society's COVID-19 webpage at arthritis.ca/COVID-19. The video and presentation slides will be emailed to all registered participants. We had a few questions about that this weekend, and the recording of this webinar will be posted to that page. And we will continue to put up as much additional information as possible on that webpage in the days to come. If we could, we'd just like to take a few more of your minutes to get a little bit of feedback on today's presentation. So for those of you that can see this question come up on your screen, please click on the response that reflects your thoughts. Did you find the information in today's webinar helpful to you? We will be sending out an evaluation form with a video. So if you're unable to access those poll questions, we'd really appreciate the opportunity to get your feedback at that time. Initiatives such as this do come at significant cost for the Arthritis Society, and we are very grateful to Amgen, the Calgary Foundation, TELUS Friendly, TELUS Friendly Future Foundation, the Province of British Columbia, and United Way Winnipeg for their financial support of the event. And we would certainly welcome your support to enable us to continue our efforts. If you have the capacity to do so, please visit arthritis.ca to consider making a donation. And as I mentioned to you earlier, I do encourage you to visit arthritis.ca/takeaction to add your voice to the chorus of Canadians asking governments to ensure that the needs of people with arthritis are not forgotten. Please remember there is excellent information available at any time on our website to assist you from the comfort of your home. Our lives are changing rapidly due to COVID-19, but the Arthritis Society's commitment to Canadians with arthritis is not changing. So this concludes the Arthritis Talks, Arthritis Pain and Delayed Surgery. On behalf of all of us, thank you for joining us today, and please do stay well.